Hello, it's Dr. Rhonda Johnson. Today is Tuesday, June 28, 2022, and today I'm discussing COVID pandemic's social isolation effects on older Americans, highlighting the effects of loneliness. But first, this point is for everyone. It's important for people to know that if you're lonely, you're not alone. And if you're not lonely, there's a strong chance that someone that you know is lonely. I recognize that seniors are not the only group experiencing loneliness. People working remotely are experiencing loneliness, and loneliness among young adults is at an all-time high. But we know that older adults with multiple chronic conditions have a higher risk of COVID-related mortality, and they're less likely to get out. Some are afraid to leave their homes, afraid to interact in large gatherings. So this message is to address the impacts of social isolation. But let's go back to 2017 when the Surgeon General issued a report talking about the epidemic of loneliness. And according to Dr. Murthy, there are many health impacts of loneliness, so we should care about this. Loneliness can cause a reduction in lifespan, similar to that caused by smoking 15 cigarettes a day, and even greater than that if associated with obesity. Loneliness is associated with a greater risk of cardiovascular disease, dementia, depression, and anxiety. And at workplace loneliness can decrease performance, can limit creativity, and can impair other aspects of executive function such as reasoning and decision making. But back to older Americans. A 2018 study by the AARP found that nearly a quarter of Americans ages 65 and older reported feeling socially isolated. This was before the pandemic. Now, some risk factors that place older adults at particularly high risk for loneliness and social isolation before COVID, of course, included living alone or living in a rural community, living in a high crime neighborhood, living in poverty, and having a lower educational attainment, having chronic medical conditions, having limited functional status and impaired mobility, being a woman, being a member of the LGBTQ community, or having previously lost loved ones. So what can we do? For those of us who have older loved ones, it's so important to connect with them. And this goes for anyone, because the pandemic continues to drag on. You know that saying, check on your neighbors? Just do that. Check on your neighbors. Encourage our seniors to get out the house. Even going to the grocery store, the pharmacy, or farmer's market, any kind of activity can combat loneliness, and they can wear their high-quality mask and feel more protected. We can encourage our loved ones, our seniors, to connect with local senior services and to participate in community and faith organizations that reflect their interests. And don't forget to call them or text message them or video chat with them, because that can provide support. I certainly don't have all the solutions to loneliness. You may have some suggestions that others can benefit from. So please share a comment to this video, and you might just be helping someone who is experiencing loneliness. Thank you so much, and be safe.